Hi, I'm Cody Smolik. I'm an advanced Rolf practitioner. I do structural integration. This work is one part manual manipulation, one part education, and one part awareness, because awareness makes a change. This work was developed by Ida P. Rolf. She was a biochemist at Rockefeller Institute. And by working with several modalities and dealing with the fascia of the body, and by stretching it, she was able to get the body back in balance. What the fascia is, by the way, it's before you take the anatomical chart. All the stuff has been taken away. It's a tissue that surrounds, permeates, and supports every other system in the body. The bones, the nerves, the muscle. So imagine this surrounding every part of your body. It fills every crevice. It makes a moving web that moves and forms as you do to create a nice balance. So I also want to invite you to think of it yourselves as not a bag of bones. You're really soft and flexible, and by the way, three-dimensional. So balance is restored. That's an interesting word, and notice that it's balance, but it's not symmetrical. There we go. So the balance is where all the tensions and compressions work together in a constantly moving form, so that it's easy and it's flexible, and you're able to be more malleable. Okay, this is a random body. This is a lot of people, and you'll notice that the head is too far forward, the back is rounded. So the lordosis at the bottom, at the back, is going to cause pain. The belly sticking out, probably a lot of digestive issues. The person is on their heels, and their knees are popped back. And this, I can liken it to a tent. You want the structure to be supported. So you've got the pole in the middle, the line, and you've got the tarp over it and the other post to kind of balance it, because you want a strong structure, whether it's a body or a tent. Now look at the difference in both of them. This is a much stronger structure. Everything is aligned, much like this tent, so it can be more readily utilized. And it's a stronger vessel. The process is a very systemized and specialized form of body work that aligns and balances the human form within the gravitational field. And that's one of the main concepts of Ida Rolf. We work within a gravitational force. Just getting up after the end of this, you'll feel that pressure. Also, it opens a core. She called it the vertical line of intention. And it's the energy, much like the post in the tent here, that the body can sort of hang on, but it also helps support the gravity, the body in the gravitational field, because once you align the body and get that energy up, it works with gravity, not against it. It restores the body's flexibility by releasing the tensions that bind the muscles. And one of the beautiful things about this is that it's very quick acting and it has lasting effects. So you can see this person. Look at the one on the left. She's very compromised. She's working around all the issues that she has. But once you line her up, she's much taller. She's got a greater balance. The energy is moving through the compromised area or the injury. So I not only work on that one focal point that's injured, I work through it so that the energy goes up. But I do work in the areas around it so it can take some of the slack. So all of the pressure isn't on that one point. So again, working around a central line. You want to, when you move your shoulders or your hips, not to drag everything with it. And that gives you flexibility. So who can benefit from this work? Whoops. Athletes, some disabled, MS, CP, autism, and burns. All ages, performing artists, office workers, pets, pregnancy, active workers, those with fibromyalgia, those wanting to improve their performance, flexibility, resilience, appearance, and well-being. And it really does help your appearance because you're lengthening the body. People actually look a little bit taller because you're lengthening the body, and there's less compression, even though it's little bitty micro bits of lengthening. So as with the athlete and the performer, the first thing that it does is opens the breath, because any performer, wind instrument, say, or an athlete, you want to be able to breathe. And this definitely opens your breath. It corrects those muscles that are overused and balances them. It's a way to self-correct and control. An athlete or performer wants to be able to move and control how they move. And you want longevity and continued enjoyment. So this, for example, in an athlete, say a golfer, all the rickety points on this person here, again, all the energy is going everywhere else. It look like they're in pain. And if you did a golf swing, it would go where there's an imbalance. So you would get pressure on the knees, on the hips, and if you're not working through your core, just say the shoulders, you're going to have issues here because the energy's not going through. And you can see what difference it makes. Also, there's a certain amount of power you can get if you use your whole body. Like this guy. He starts out with a wonderful form. He's able to carry through, and notice his foot is on the ground. And he gets all that power because he's working from the earth all the way out. And he's not going in a circuitous way to get that out. And there's going to be no injury. Look how graceful. So cerebral palsy. And I'll talk about this one because there is contracted tissue and also muscle imbalance, hypertoned, and those that are lax. The same with MS. There's a scar tissue that happens, multiple scars. And there's one, the tissue becomes tougher and begins to infect the surrounding tissues, which happens when you're compromised from an injury. If you don't work it out, it's going to keep, almost like a cancer, affecting other areas of the body. Just like if you do correct it, it'll help other areas of the body. Burns. I was privileged to work at the Shriners Burns Hospital for Children in Galveston, Texas a couple of summers ago because I wanted to see how this work would help, if possible, people with the most compromised tissue. And it was very successful, and for the same reasons. When you get a second or third degree burn, the tissues start grabbing, much like a scab, but it's on a larger plane. Also, if they're burned on the chest, for instance, they're not breathing, and you need to open the chest to let breath come through so that circulation can begin and the blood flow can start happening. And you get balance, so they're not in as much pain. Also, the caretakers are, better able to cope because these people can get sleep now and they can move. And even if it's not in the core, everywhere else it would be helpful, but there was movement in the core, and that does exist. So say this boy, he's listing to the left or the right, and he's only 17. Can you imagine when he's 47 what's going to happen? And the reason for this, and this is after 4 sessions, he was burned in his left calf to the bone, and he was missing a couple of toes, so obviously he wasn't balanced. If you can lengthen this body and put the body back in alignment, then he's more apt to be able to balance both sides, therefore, strengthening the side that's weaker. And you can see him from the side here. Once we do 4 sessions, he's more lengthened, he looks more alive to me, his head is more forward, and he's starting to use his buttocks, his legs, to help him. Autism, for those with impaired motor development, it's the same issue, the imbalance in the tissue. And then the elderly. The older we get, the more we want to be able to move and to enjoy life. And wouldn't it be wonderful if you trip to be able to catch yourself? So instead of falling directly on your hip. I mean, it's like, when do you want to be old? You don't have to be immobile when you get older. If you choose to, perhaps. But you want to be able to do something to help that. So for all of these issues, by working the tissues around the tightened ones, elongating and ungluing the layers that are bound, separating the fascia from the muscle, so again the fluids can go through and the muscles can slide against each other. The movement is easier, the body is in balance, and there is a sense of well-being, being well, and there's more confidence that goes along with that. So I think I touched on this. It opens the breath, I think all the way through it. The tissue's rehydrated. You work from your core. And I think that's it. If anyone has any questions at all, please let me know. I'll be here after the presentation. So come up and ask me any questions that you'd like. No, it's not massage. It's very different from massage. It goes a lot deeper. It's more systemized. I go layer by layer. There's an educational aspect to it. And it's not chiropractic work either. It's a totally different modality. And I also deal with the fascia. Does it hurt? No. It doesn't have to. Now, this is a work between the client and the practitioner, and also how the practitioner works. We go layer by layer so that there's not the pain. And if it does bother the client before they're used to it, then they need to let the practitioner know. Also, another reason we go layer by layer and we do sessions, if the tissue gets used to it, it becomes more malleable and it's more readily able to open up. And this was in different phases from the medical articles I was reading in the hospital in Galveston. There's 3 phases, and it coincides directly with Ida Rolf's work. There is 3. There was the Rolf Institute, and that's where the terms Rolfer and Rolfing come from. Now people, actually some of the elder members of the Institute developed the Guild for Structural Integration, and that's what Ida Rolf had first named it, and structural integration. Now there are, like, say, several different forms under structural integration. There's Hellerwork Structural Integration, the Guild for Structural Integration, where I was a graduate, and now the Rolf Institute is saying the Rolf Institute for Structural Integration. So they each have a little bit of a different bent to it, for lack of a better word. Generally, it's a 10-session series group of sessions, and it's designed to open the body. Though I do one-off work, so to speak, if someone has one particular issue, but I do use the same techniques for that area. Thanks for that question. That's a big part of it. Thank you. This is us. We're very compressed, right? Can't really move that much. And these are all the muffin tops you have and the muscles that aren't working. But what if you could lengthen that? Then the muscles start working. And there's room for the guts and everything to go. But even more than that, coming through the center. You want to be able to come through the center, and there is such a thing as a core that's moving. And we're all supposed to be able to move from the core. So this, and then once you're like this and open, you can move. There's a flexibility, there's a resilience. So this is what I aim for in this work. Well, for losing weight, when people I work on, they're coming for a change. They're coming because there's no place else to go for them. So because you're lengthening, they can look thinner. And most of them then start trying to lose weight. But I actually had a beauty consultant that came in because she wanted to look better. And it does, it gets you more alive. And because you're getting the fluids open, the fluids in your body circulate better. Thank you very much.